Bismillahirrahmanirrahim. Assalamu alaikum. Hope all of you are doing well. Last time we have discussed different aspects of case control study. To continue with our discussion regarding different epidemiological study designs, we will focus today on cohort study design. Besides revising the concepts already covered in our classroom, including types and steps of cohort study, we will try to learn different types of biases and means to minimize bias in cohort study, advantages and disadvantages, and differences between case control and cohort studies. To start with brief revision of previous discussion, a cohort study is an observational analytical study like case control. Question arises, what is cohort? In epidemiological terms, the cohort is a group of people who share common characteristics or common experience within the defined period of time. Important is defined period of time, sharing of common characteristics or common experience. For example, all those born in year 2020, birth cohort of 2020, cohort of 4th year MBBS students, persons exposed to COVID-19 during this year, that is exposure cohort, deaths during 2020, death cohort. Synthetic cohort is man-made cohort, especially made for study purpose only. It is not natural cohort. In this study, we have to select group of people without the disease. For example, if we want to study about cause of lung cancer, we will select a group of people who do not have this disease. Then divide them into two groups on the basis of exposure to a suspected risk factor. If smoking is a suspected risk factor, then divide the person on the basis of smoking, that is smokers and non-smokers. Afterwards, follow both groups for a period of time and then assess occurrence of disease, occurrence of CA lung. Cohort study proceeds from cause to effect, exposure to outcome, risk factor to disease. Keep it in mind, cohort must be free from the disease under study. Both groups should be equally susceptible to the disease. Both groups should be comparable in respect of all the possible variables which may influence the occurrence of disease. For example, they must be the same age group. Children of अंडर 5 years of age को हम ओल्ड एज ग्रुप के साथ कंपेयर नहीं कर सकते ड्यूरिंग कंडक्शन ऑफ कोहॉर्ट स्टडी. द डायग्नोस्टिक and eligibility criteria of the disease must be defined before the start of. 3 types of cohort study have been distinguished on the basis of A. the time of occurrence of disease in relation to the B. time at which the study is initiated and continued. First type of study is prospective or current cohort. It is more common. Most prospective studies begin in present and continue into the future. Second type of study is retrospective or historical study. In this design, researcher goes back in time and identify study subjects from past records. Third type is combination of retrospective and prospective. In this design, both the retrospective and prospective elements are combined, cohort is identified from the past records. While conducting the cohort study, we have to go through 5 steps, or we can say there are 5 elements of this study. Elements भी कह सकते हैं, steps भी कह सकते हैं. The first one is selection of study subjects. So first element is we have to select study subjects. We can select subjects from general population. We can also select subjects from special groups like professional groups. For example, doctors, nurses, or workers in a factory. We can also select subjects having exposure to some physical, chemical, or biological agent, like staff working in radiology department. That is an exposure group. जो स्टाफ रेडियोलॉजी डिपार्टमेंट में काम करता है वो एक्सपोज हैं एक्सरेज के साथ. Second element is collection of data on exposure. Information about exposure may be collected from cohort members through interviews or through mailed questionnaire. We can also collect information from records. In a cohort study, in some cases, information needs to be collected from examination of the subjects or from lab tests. For example, blood pressure, hemoglobin level. We can also collect information by conducting environmental surveys. Sometimes it is required to find out exposure level. Third element is selection of comparison groups or selection of comparison population. There are different ways of formation of comparison groups. Internal comparison. In some cohort studies, depending on degree of level of exposure to the risk factor, comparison groups are inbuilt and no external group is therefore required. Within the same group, comparison हो सकता है depending upon degree of level of exposure to the risk factor. We can also do external comparison in those studies where data on degree of level of exposure is not available. Then external comparison is required. We can also do comparison with general population in case when internal or external comparison is not possible. Then experience of the exposed group is compared with the experience of general population. Fourth element of cohort study is follow-up of both groups, that is follow-up of exposed group and non-exposed group through medical examination, review of hospital records, or we can send questionnaire to group members, or we can visit their homes, or we can call them to collect information. Finally, After data collection, analysis is to be done. Why? To find out study results and their interpretation. Through analysis, we can find out study results and interpret them. We can find incidence rates of outcome among exposed and non-exposed by analysis. We can also calculate relative risk, attributable risk, population attributable risk. So, cohort study is very important because we can find out incidence by conducting cohort study. Through case control, we can only calculate odds ratio. There is an exercise to be done in your own time. Please all of you draw this 2 by 2 table shown in the slide. Draw 2 by 2 table and calculate relative risk, attributable risk, population attributable risk, and interpret your findings. Now note it. Hope all of you are noting it. This table is showing presence or absence of risk factor, presence or absence of disease, presence or absence of smoking as a risk factor, and disease is lung cancer. Note it and calculate relative risk, attributable risk, and population attributable risk, and interpret your result. Interpretation is very important. This will help you in preparation of your final exam. ये क्वेश्चन फेवरेट है यूनिवर्सिटी एग्जामिनेशन में. So kindly do it. Like case control design, certain biases can also occur in a cohort study. Bias is any systematic error that can distort the study results. Systematic distortion of study result can arise due to bias in a cohort study. We have discussed biases in case control study during our previous discussion. Now we are discussing biases in cohort study. First bias that can occur in cohort study is measurement, or we can say ascertainment bias. Ascertainment means to ascertain the facts, to make certain or to make clear. Ascertainment or measurement bias arises during collection of data or during measurement of exposure or during examination of subjects. It can systematically distort study results. This bias usually occurs due to error in technique or error in instruments used during the information collection. How can we obviate, avoid, or prevent this bias to occur? This we can do by ensuring that all observers receive the same training. We can also avoid it by ensuring use of similar types of instruments or by ensuring similar techniques of measurement of exposure by all observers. So all observers of both groups, exposed group and non-exposed groups, are examined by observers who have similar type of training and using similar type of instruments and techniques. Another type of bias is crossover bias. What is crossover bias? All of you are now familiar that cohort study starts with two groups. The group having exposure to the risk factor is called exposed group. The other group do not have exposure to the risk factor and is called the non-exposed group. Cohort study comprises of two groups, exposed and non-exposed. For example, if smoking is a risk factor, then exposed group comprises of smokers exposed to risk factor, and non-exposed group comprises of non-smokers. Non-smoker, non-exposed group, not exposed to smoking. This may sometime happen during follow-up. Smokers may stop smoking and cross over from exposed group to the non-smokers group, that is non-exposed group, and vice versa. Sometimes smokers stop smoking and cross over from exposed group to non-exposed group. To overcome this problem, periodic evaluation of both groups is needed to measure level of exposure. So to minimize this crossover problem, periodic evaluation of both groups is required, and adjustments during analysis can also help to diminish this bias. Adjustment at the time of analysis can also help to minimize this problem. Next is the observer bias. This can occur when observer, interviewer or investigator is informed about which subject is exposed to the risk factor and which is not. जब इंटरव्यूअर और ऑब्जर्वर को ये मालूम हो कि कौन सा सब्जेक्ट एक्सपोज्ड है रिस्क फैक्टर से और कौन सा सब्जेक्ट एक्सपोज्ड नहीं है रिस्क फैक्टर से, तो अब बायस या एरर का चांस होता है. हाउ कैन वी कंट्रोल दिस बायस? बाय ऑप्टिंग ब्लाइंडिंग. वी कैन प्रिवेंट ऑब्जर्वर बायस, blind the observer about the exposure status of subjects, keep observer unaware about the exposure status of subjects, the details of exposure being only known to another co-worker who is not involved in making any observation or information collection regarding ascertainment of outcomes. So there are three types of biases in cohort study, and we have discussed how to minimize, control or prevent them. Let's focus on advantages and disadvantages of cohort. First, advantages. Always start with the positive aspects. Number one advantage is temporal association or temporal sequences clearly established in this design. Why? In cohort study, we select subjects on the basis of exposure and observe occurrence of disease. We can find out effect of exposure or effect of risk factor on disease. Temporal association of risk factor or temporal association of exposure with disease is more suited for assessing effect of rare exposure, like effect of radiation. Second advantages, by conducting this study, we can calculate dose response ratio, dose of the exposure and response of occurrence of disease. For example, if smoking is a risk factor, in a study, number of cigarettes smoked and occurrence of CA lung. Incidence can be calculated. It is therefore also called incidence study. When incidence is there, direct estimate of relative risk is also possible, and we can also calculate attributable risk and population attributable risk. Another advantage is selection bias is minimized in cohort design, which is more in case control study. We have already discussed about it. Why selection bias is minimized in cohort? Because comparison groups are formed before occurrence of disease. So, minimum chances of selection bias. By cohort study, we can find multiple disease outcomes. By cohort study, we can find multiple disease outcomes by studying single exposure or single risk factor. For example, a cohort study was conducted in USA on 120,000 nurses to find out the effect of use of oral contraceptive pills. Researchers observed multiple outcomes from this single exposure, that is breast cancer, ovarian cancer and malignant melanoma. Now disadvantages. Number one disadvantage is in cohort study design, large sample size is required. Second disadvantage is it is not suitable for rare diseases. As in case of rare disease, very few subjects are available, and in cohort, large sample size is needed. It takes more time to complete this study, and it is expensive also. It is time consuming and expensive. Sometimes it may happen that the exposed group registered in this study changes its behavior. जो सब्जेक्ट्स एक्सपोज ग्रुप में रजिस्टर्ड होते हैं वो स्टडी की वजह से अपना बिहेवियर ऑल्टर कर लेते हैं. Attrition of initial cohort is quite common as it is a lengthy process. it takes more time to complete cohort, so it may happen sometimes that initial cohort moved out from the study. Due to prolonged follow-up, sometime it may happen that diagnostic criteria of the disease is changed. There is large number of people enrolled in this study. It is lengthy, expensive, more staff is required. So administrative issues come across. Last one is ethical problem. Researcher observe the effect of risk factor or exposure on the occurrence of disease. Just observation to note appearance of a disease is unethical. Ethically, he or she must intervene to reduce the effect of exposure or risk factor. So these are some advantages and disadvantages of cohort study design. We have discussed the cohort and case control studies. Now we will focus on some important differentiating points between these two. Design of both case control and cohort studies is the same, that is observational, analytical. Case control study proceeds from outcome to exposure, while cohort proceeds from exposure to outcome or from risk factor to the disease. We can establish temporal association by cohort, not by case control study. Why? Because cohort proceeds from exposure to outcome. We can calculate odds ratio by conducting case control study, while incidence and relative risk are known by the cohort study. Selection bias, recall or memory bias, and information bias occur in case control, while ascertainment or measurement bias is the problem with the both studies. Confounding bias can also occur in both studies. Case control study is quick and less expensive, as a small sample size is required. Cohort is lengthy and expensive, as large sample size is required. These are the differences between the cohort and case control studies. Today we have discussed different aspects of cohort study like inbuilt biases, advantages and disadvantages. We also highlighted difference between case control and cohort studies. So up till now we have discussed observational studies designs. Allah Hafiz.